What is developmental regression? Have you ever wondered why some children seem to lose skills they once had? This phenomenon is known as developmental regression. It is important to understand this concept, especially in the context of autism spectrum disorder. Developmental regression refers to the loss of skills or abilities that a child had previously acquired. This is different from developmental delay, where a child does not reach expected milestones on time. In regression, a child loses milestones they had already achieved. In children with autism spectrum disorder, developmental regression often occurs between the ages of 15 and 30 months. During this time, a child who initially develops typically may start to lose previously gained skills. The most common areas affected are language and social abilities. This loss can happen suddenly or gradually, and it may be followed by a period where skill development plateaus. The skills that might be lost during developmental regression can include spoken language, social engagement, play skills, emotional regulation, and even motor abilities. It is estimated that about 1/3 of young children with autism spectrum disorder experience some form of regression. Interestingly, many of these children show subtle developmental differences before the regression becomes noticeable. The exact causes of developmental regression in autism spectrum disorder remains unclear. Some theories suggest that neurological factors, such as possible subclinical epilepsy, might play a role. However, no definitive mechanism has been established yet. Developmental regression can complicate the diagnosis of autism spectrum disorder. The loss of skills may be misinterpreted as a sudden onset of autism or confused with other developmental disorders. This is why early and accurate diagnosis is so important. It ensures that children receive appropriate interventions and therapies, such as speech therapy and occupational therapy. These therapies can help children regain lost skills or develop new ones. Recognizing developmental regression is vital for monitoring early childhood development. It highlights the need for tailored interventions that meet each child's unique needs. It is also important to note that regression does not necessarily predict better or worse long-term outcomes. Each child's developmental journey is different. In summary, developmental regression in autism spectrum disorder involves the loss of previously acquired skills, particularly in language and social areas. This aspect of autism requires careful attention to provide timely support and intervention. Understanding this phenomenon can help parents and caregivers navigate the challenges that may arise during early childhood development.